Everybody, I'm Dr. Hawk. This is Manny, our model, and Kirby will be our IV stand today for holding the fluids. We're going to demonstrate how to do subcutaneous fluids in cats. So first, this is lactated ringers. It comes in a big plastic container. We're going to rip that open. So that's what the bag looks like. And you'll see there's this plastic cover. We're going to take that off, exposing the opening to the IV bottle. Then we're going to take our IV set here and open that up. And we're going to see this big end here. We're going to take this plastic cover off, and you can see the sharp end there. That's going to go directly into the IV bottle, and we're going to push it firmly into the bottle. It's fairly snug, but it goes right in. And then we're going to show you how, so that this is the open and close for the IV. So right now it's running through, and it already ran through. I'm going to just take this end off so you can see it come out. So when we have fluids, when we turn it on, we roll this little roller up, and it will start to drip out. And you can see that it's coming out now. And if we close it off, that'll all stop. So now that we've got this all loaded and we've got the line full of fluids, we're going to take, this is an 18 gauge needle. We're just going to simply undo it, put it on there. This is going to screw on. It's going to screw on, screw off easily. And then we're going to just take that off when we're ready to give it to Manny. So I'm going to have my IV stand here, Kirby, hold the fluids up. And subcutaneous fluids is just like a subcutaneous shot in a cat. We're just going to make a little tent here where we can feel underneath here. We can feel there's just an opening to the skin. We're going to stay at a 45-degree angle and a quick poke. Okay, so that's done. So the injection is done. Now we just open the fluids up right there. So we're going to open it all the way, and you can see on my IV stand Kirby how it's dripping, and it's dripping underneath the skin. And what we're going to do with Manny is a lot of times we probably do 100 to 150 cc's per administration for most cats. Today we're just going to use Manny as a very nice demo unit here. So that's how we do it. And we would just simply wait until that much fluid is passed through. Then once the fluids are done, and we'll assume that we've given 100 cc's to Manny, we're going to close this off so that the fluids stop. We're going to remove the needle from Manny. We're going to kind of pinch off where we stop giving, because sometimes the fluids will leak through that little hole once we do it. So we're just going to kind of pinch that off a little bit. You can see Manny doesn't really care. And then we're going to put the syringe cap back on the needle so that it can be safely removed. A lot of times we'll leave these on for future use, but getting these on and off can be a challenge at times. So again, if you just spin that top like that, it spins on and it spins off. And that's how you're going to take it on and off. So I hope that video helps in giving subcutaneous fluids to your cat. And again, I always recommend doing it around mealtime so that they feel like they got a reward for sitting there while they have their fluids done. Again, I hope that helps. Bye, everybody.